You're free to talk and ask here.
Hi, ma'am.
Hello.
Actually, I just want to know about IVF. Like, it is very painful or how it works. I was scared about that IVF treatments and all. So, doctor has suggested me to go for IVF. So, can you please tell me about that?
See, it's a very big myth that IVF is a painful procedure. It is not. improving your pregnancy success rate to some extent. So it is called as intrauterine insemination. And then the third type of treatment comes, which is IVF or the test tube baby. So in that kind of a treatment, there are some injections which are given to grow more number of eggs. In IUI or ovulation induction, we are growing only 1 or 2 eggs. In IVF, we are trying to grow all the eggs. So once the eggs are all grown, those eggs are then taken out, which is under anesthesia, and there is no cut or stitch in that. So it is not a painful procedure at all. So eggs are taken out. That day, the husband gives a semen sample, and that semen sample is also screened under a microscope, and the best sperms are selected. And then the egg and the sperm are mixed to form embryos, and then directly embryos are deposited inside the uterus. So that means the success rate is even higher. So basically, these are the three kind of treatment. What kind of a treatment will be required, or that depends upon your diagnosis, your investigations, what all problems you are having. It all depends. So it varies from patient to patient.
Hello, doctor.
Hello.
Oh, what is the symptoms for the male infertility, doctor?
Symptoms basically will not be there. You may not even be knowing that you are having any problems unless you do a semen test. So if once you do a semen test, and then you will be getting to know about your sperm parameters, and then only you can know what's the problem, or is there any problem or not. But other than that, there are people who may be having some ejaculatory disorders, that is difficulty in ejaculation, or premature ejaculation, or delayed ejaculation, or erectile dysfunction. Those kind of problems are there. Always the doctors, fertility specialists are available to treat that.
Hello, ma'am.
Hello.
What is the age factor for infertility, ma'am?
Sorry, pardon.
What is the age factor for infertility?
Age factor, as I told you before, that after 30 years, the egg number starts declining. After 35 years, it declines further, faster. And then after 40, it is even farther. See, the thing is that after 35 years, it's not only about the egg number. The egg quality will come down, and the chances of having an aneuploid embryo, that is chromosomally abnormal embryos, rises. So even if you do conceive, then also chances of abortion become much higher. So that is the reason that we tell that plan it earlier than later.
Hello. Hi, doctor.
Hello. Hi.
Doctor, in IVF, many medications are included. So, any side effects is there for that medications?
Regarding if you are talking about the hormones, I'll just tell you something. These are the hormones which we give during the IVF, right? So those hormones are present in your body itself. Those are the same hormones which are helping you grow an egg naturally also. We are just giving you those hormones in a slightly higher dose so that we grow all the eggs. Okay. Now the thing is that regarding the side effects, usually no major side effect happens. It is very, very rare that the patient to hyperstimulation, but hyperstimulation is also in mild stages. It is managed without any much of intervention which is required, just conservative treatment. It can be managed. So no major side effect as such. And once you get a period, everything will come down back to normal. Your ovaries will start shrinking back to normal. Your hormones will start settling. So it's not no major side effect basically from your IVF medications.
Thank you, doctor.
Thank you.
Ma'am, how do you know if I am infertile?
So the thing is that infertility, when do we say that you have infertility? If full year you have tried and have had regular unprotected intercourse and you're not able to conceive even after 1 year, then we say that you may be having infertility issues. So that is the point where you should be thinking and considering of meeting a fertility specialist and get yourself tested. But if your age is more than 35 years, after 6 months of trying and having unprotected intercourse, if you are not able to conceive, please do meet a fertility specialist earlier rather than just waiting for an hour. Or otherwise, if you have some menstrual problems, if like you are already knowing that you are having PCOD, or if you're having delayed periods or irregular cycles or anything, meet earlier.
Thank you, ma'am.
Thank you.
And can we rely on the success rates which are usually published by the fertility centers? So how is it, guarantee that, that was a success rate with them for the treatments? How can we trust on them?
I cannot answer that how can you trust, because every center will be different. What I can answer you is about our center, and that definitely I'm not going to tell you that any fake numbers or something, because it's not going to help anyone. And forget about the center wise. If you just do an ovulation induction and a timed intercourse, globally the success rate 7 to 10%. If you do an IUI, it is 10 to 15%. Max to max, it can go to 20% if everything is too good. And if you're doing an IVF, it is 40 to 50% globally. It is not more than that. But there's in one transfer. In IVF, you can get extra number of embryos, right? So if you have more number of embryos in one transfer, we are giving you a success rate of 40-50%. Extra embryos will remain frozen. So if suppose first time you're not getting pregnant, then the extra embryos which you have, you can just melt them and transfer again. You don't have to go through an IVF cycle. So try and achieve the standard success rate, because your success is our success, right?
Thank you, ma'am.
Thank you.
Hello, ma'am.
Hello.
Yes, how can we plan pregnancy naturally?
So naturally, when you are trying a pregnancy, now I'll just tell you when the fertile period will be there. Whenever your periods have come, just take that first day as a number one day, or if you count from that day, like that. If you count day 1, 2, 3, so usually if your cycles are regular, that is, if it's coming in 28 to 30 days regularly, so between the 10th day to 20th day, just try alternate day. That will be the time when maximum chances are there that you will be ovulating at that time. So just try alternate day between 10th day to 20th day, and then you can have higher chances of pregnancy at that time period.
Thank you, ma'am.
Thank you. Thank you all. And if any
Thank you, ma'am.
doubts, any any issues, you are most welcome to come and meet us here at Oasis Fertility, Banshakti, Bangalore. Thank you.